being digital for me in healthcare means that we need to have the flexibility of the mindset to say that healthcare needs to change and that new business models need to be adopted. And having that mindset be embodied in the organization at scale means that an organization is digital and that it's ready to make the same leap that Netflix has made 3 times in the last 10 years and be really oriented around solving consumer problems with convenience and access and affordability in a way that it's never been done before.
I'm offended that we operate in a sector of the economy that's still so driven by inefficient processes. You talk to anybody in banking or finance or retail, and you try to articulate the problem of health plans overpaying billions and billions of dollars a year and then having to claw dollars back from their providers of services, and it's just silly, right, that we do that. So I think it's super important that digital is efficient because we have to eliminate a lot of this waste.
Healthcare is and will always be about relationships and execution. So for us, it's about how we use tools to relate better to people that we care for and engage with, and to be able to execute more effectively than others around us. If you ask a room of people how many people have texted with a loved one this morning, more than 10 times, basically everybody will raise their hand. And if you ask them how many people have texted with their doctor in the last year, you'll get maybe 10 or 15 people in a room full of 200. So when we think about the ways that we interact with a population, building a culture that is normatively based in very different ways of building relationships, using tools to do so in a seamless way, interacting however our patients or members want to interact, is the first aspect of that unique approach.
So many of our partners have built integrations with us in a matter of weeks. It's pretty complex integrations. We have an entire tech kind of sales engineering team that actually helps with that integration, really holds their hand through that journey. And we've also built functionality for the API that didn't exist before some of these partnerships. To solve these problems in healthcare, it's going to take tech companies and folks within the healthcare industry, and we need to work together. And we don't need to think that the Lyft solution as it exists today for the consumer is going to meet those needs. We really need to work together to build that custom integration, and to me that's exciting.
Efficiency will be on the patient side or the consumer side. So for example, imagine a predictive model, a research project where that can help patients better understand their most optimal anti-epileptic drug, or the most optimal supplements if they have Crohn's disease, or the most optimal anti-depressive medication. So those are things that can truly help patients, together with their doctors, take medication that are going to help them, that are going to be optimal, instead of going for an average cocktail of medication, implying a lot of trial and error.
We had to create a new category to explain what's happening in healthcare, and that's called applied health signals. And essentially what we're doing there is we're taking all of this information that we aggregate. That's information from our own devices that are attached to people's bodies in many cases, paired with information from pharmacy benefit managers, from electronic health records, and we're aggregating all that. Then we're interpreting it to say, how do we make sense of that? And how do we give you a personalized solution? Just like Netflix figures out what we like, or Amazon figures out what we like.